I just cannot believe that people think that memory loss is not part of getting older, or that they say that it is dangerous for seniors to exercise. Beliefs like these are outdated, sometimes harmful, and often stop people from living better, longer lives. Today, we'll bust the most common health myths seniors still believe and give the real science-backed truth behind each one so you, your parents, or the seniors in your life can make smarter choices. Stick around. The third myth might surprise you and change how you think about protein and aging forever. Later, I'll reveal a simple daily habit that studies show can cut a senior's cardiovascular risk substantially. And it's easier than you think. Myth 1. Memory loss equals dementia. Myth. If I forget names or appointments, I must be getting dementia. Truth. Not true. Occasional forgetfulness, misplacing keys, forgetting a name briefly, can be a normal part of aging. Dementia, however, is a syndrome marked by persistent, progressive problems with memory, plus thinking skills that interfere with daily life. The key differences are frequency and impact. Normal aging doesn't stop you from living independently. If forgetfulness affects daily tasks or gets worse over months, see a clinician. Early assessment matters because some causes of cognitive change are treatable or manageable. So how do you tell the difference in one simple test? I'll give you a quick checklist you can use in under a minute later in the video. Exercise is risky for seniors, like better to slow down. Myth. Exercise is dangerous for older people, rest is safer. Exercise is one of the single best things older adults can do. Regular physical activity reduces the risk of heart disease, stroke, type 2 diabetes, helps maintain bone and muscle strength, improves balance to reduce falls, and even supports brain health and mood. Exercise can help seniors stay independent longer. That doesn't mean extreme workouts. It means tailored, regular movement, walking, resistance bands, water aerobics, or chair exercises. Even small increases in daily steps produce measurable benefits for older adults. Always check with a doctor if you have chronic conditions, but don't avoid activity out of fear. Later, I'll show a simple 10-minute strength routine you can do at home. No equipment that preserves muscle and balance. Myth 3. Older people need less protein. Less is fine. Seniors don't need as much protein. Eating less protein is fine. As we age, protein becomes more important for preserving muscle mass, strength, and function. Aging muscles respond less strongly to protein, so older adults often need more protein per kilogram of body weight than younger adults to maintain health, particularly if doing strength training. Adequate protein helps prevent frailty, supports recovery from illness, and keeps metabolism working. Practical tip. Aim to include a moderate portion of protein at each meal. Lean meats, dairy, legumes, eggs, or fortified plant options. For many seniors, the usual recommended daily allowance may be too low. Talk to a dietitian for personal numbers. Want an easy protein rule you can start tomorrow? I'll give a simple plate formula in the takeaways. Vaccines don't work for seniors. Myth. Vaccines aren't effective in older adults, so why bother? Vaccination still provides important protection for older adults. While immune responses can be reduced with age, vaccines like the flu shot, COVID boosters, and pneumococcal vaccines have been shown to reduce severe illness, hospitalizations, and death in seniors. Higher dose or adjuvanted flu vaccines that work better in older adults. Vaccination is a key preventive tool, especially for people with chronic conditions. Discuss options and timing with your healthcare provider. I'll explain later which flu shot type is often preferred for people 65 plus and why, plus a sneaky scheduling tip to get the most protection. Myth 5. Pain is just part of getting old, nothing to be done. Myth. Aching joints and constant pain are just what happens with age. You have to live with it. Truth. While wear and tear can contribute to pain, chronic pain is not an untreatable inevitability. Many causes of pain, osteoarthritis, neuropathy, tendinitis, have effective treatments, medication strategies, physical therapy, weight and activity modifications, assistive devices, injections, and in some cases, surgery. Ignoring pain can reduce mobility and independence. Seeking assessment can improve quality of life significantly. Pain should be evaluated rather than accepted as just aging. Later, I'll describe a surprising home strategy that often reduces joint pain by changing one daily habit. Myth 6. Supplements replace a healthy diet. Myth. If I take vitamins, I don't need a good diet. Truth. Supplements can help when there's a proven deficiency, vitamin B12, vitamin D, calcium in some cases, but they are not a substitute for a balanced diet. Whole foods provide fiber, antioxidants, and complex nutrients that supplements can't replicate. Overuse of supplements can interact with medications, cause harm, or give false reassurance. The better approach: aim for nutrient-rich foods first, test for deficiencies when indicated, and use supplements only under professional guidance. At the end, I'll list 3 blood tests seniors should consider, and one you might be surprised by. Myth 7. It's too late to change. Habits won't matter at my age. Myth. If I haven't exercised, eaten well, or controlled blood pressure earlier, it's too late now. Truth. It's never too late. Studies show meaningful benefits when older adults adopt healthier habits. Improved mobility, better mood, reduced risk of cardiovascular events, and sometimes slower cognitive decline. Even modest changes are walking more, adding strength training, improving diet, managing blood pressure and blood sugar yield real gains. Improvements in function and quality of life can appear within weeks to months. Age is not a reason to give up. It's a reason to act. I'll give a 1-week starter plan anyone can follow. No gym membership required. Takeaways, practical tips, and quick wins. Top 7 practical takeaways. Don't ignore changes. See a clinician if memory or pain affect daily life. Move daily. I will aim for regular activity. Even plus 500 steps helps heart health. Prioritize protein at each meal. It protects muscle and independence. Get vaccinations as recommended. They reduce severe illness and hospital stays. Treat pain. Consult a professional. Therapies often help. Food first over pills. Use supplements only after testing or a clinician's advice. Small changes help. It's never too late to start improving health. If you or a loved one grew up believing these myths, now you have the truth and the power to make better choices. If this video helped you, subscribe and hit the bell so you don't miss the next one where I'll walk you through that 10-minute strength routine and the quick 1-week starter plan. Tell me in the comments which myth surprised you the most, or share one wellness habit that changed your life. I reply to as many comments as I can. Stay curious, stay active, and remember, age is a number, not a sentence.